A hair transplant can end up working really well. But sometimes there is the other side of that coin. Here are the 7 most common hair transplant regrets that people might have after getting one done. So the purpose of today's video is to try and help people make better decisions and help avoid having these regrets, because ultimately when you get one done, you want to feel really good about it afterwards and you don't want to have any problems, complications turning up down the line. Number 1, making an immediate emotional decision. Remember, it's a surgical procedure and it's something very important because the result is going to be quite visible after you get one done. You can't exactly hide this hairline from everyone else unless you wear hats for the rest of your life. So you want to make sure that you're not rushing into this decision, you're not making an emotional decision, you're making a logical decision. And that involves choosing the right person, choosing the right technique, having the accurate number of grafts and things of that nature. 10-15 years ago, this was a lot more difficult because there was a lot of lack of information around. YouTube wasn't as big or as popular as it is now. The internet didn't have quite as many resources for people doing their research. So people sort of had to go based off the surgeon's word, based off the clinic's word. Nowadays, we have the opposite problem, unfortunately. There's too much information out there. So of course, there's good information, and I try to give good information about what to expect and what's reasonable. But there's a lot of people giving misinformation or poorly researched information, or just information in order to help them generate more money that goes against what is actually true or actually correct. Most commonly what I'm seeing, outlandish claims about the donor area regrowing afterwards, or the amount of grafts that someone would need. So too much misinformation is also bad, but not doing enough research is also bad. So hit that sweet spot, do good research from proper sources and make a logical decision about where to get your hair transplant done. Number 2, people don't understand progressive hair loss. And what I mean by that is that there's a crucial thing to understand. A hair transplant does not stop hair loss. You've ended up in this situation of hair loss naturally over time. It's probably been going on maybe 3, 4, 5 years or so, or maybe even longer in certain cases. Just because you get a hair transplant done doesn't mean that that process is going to stop. And you don't want to end up in a scenario where 5 or 10 years after you've had a transplant done, the only hair that's left is now the transplanted hair, because that stays forever. That doesn't really go anywhere. But all your natural hair is now gone. So you can almost end up with an inverse sort of hair pattern of where your hair used to be. You don't want to end up in that scenario. And really, things like medication, PRP, and other sort of treatments are going to be crucial to stopping that from happening. Any proper clinic or proper surgeon is going to have a conversation with you about medication, about alternative treatments for natural hair after the procedure. Number 3, the regret people have is underestimating preventative treatments. This kind of ties in with the regret number 2, where I mentioned medication and PRP. Again, that problem is where natural hair goes away. So you do want to get a medication early on, even before the transplant, because that will not only save and maintain what hair you do have, it also does strengthen that donor area, which makes it easier for the surgeon to get a good result, but also afterwards preventing any further hair loss. Typically for most men around about 50 years of age, naturally your DHT, your testosterone levels will drop. It can be variable. Some people at 52, 48, so on and so forth. But around about that age, people's testosterone will naturally drop for men. And when that happens, typically the hair loss problem also corrects itself, so it stops at that point. And the hair you have left at that point tends to be the hair you have for the rest of your life, assuming no infections or other skin conditions turn up. So essentially what you're trying to do is try and maintain that hair till around about that age, and then you're golden for the rest of your life. Number 4, thinking one transplant would be enough. Now don't get me wrong, oftentimes one transplant is enough, right? You can actually get a significant amount done. But what happens is you're getting some patients, either because they're traveling somewhere, so they don't really want to travel more than once, or it's a financial issue, and of course multiple surgeries would cost more money. But you don't want to be doing too many grafts in one go, because the more grafts you do, the more grafts you extract from that donor area is more trauma to that donor area in one go, in one day, right, in one session. And so the more trauma you put onto that donor area in one go, the higher the risk of scarring afterwards. And I'll put some pictures up in this video, but you can see how bad the scarring can look afterwards. For someone with a strong donor area, let's have a look at mine. I've got it a little bit short, but I've got a relatively good donor area going on. Someone like myself could probably support about 4,000 grafts in one go with no real visible difference going on after. Just a little bit more thin than it was before, but it wouldn't be visible, it wouldn't be easy to see. But going above that, doing 5,000, 6,000 grafts, which some people are going for, really does raise that risk to the point where the scarring is very visible and it's very patchy afterwards. And the problem there is that scarring is permanent. There are ways to cover it up, like with SMP, which is tattooing of the skin and so on, but essentially that's a permanent thing because a transplant moves grafts from one area to another area. So that hair follicle that was there is gone from that area. It's now been moved to a different area. If you need a lot of grafts, let's say you're completely bald and you need 5 or 6 or 7,000 grafts in total, it is much more reasonable to split this over several sessions rather than getting it done in in one go. Trust me, you'll thank me later, because the back of your head will still look good for a long time if you split it over a period of time. Regret number 5 is when people have unrealistic expectations. We can't turn everyone into Brad Pitt. It's not going to happen. That's very, very dense. That's almost impossible to achieve using artificial methods, using surgical methods, because really a surgeon can achieve around 30, maybe 40 follicular units per centimeter squared. Natural hair can go anywhere up to 80 follicular units per centimeter squared. So we can't really reach the same density as natural hair. So we don't want to temper your expectations. However, if you're bald and getting you up to 30 or 40 follicular units per centimeter squared, will look pretty good. Will look quite dense. There are other factors involved in whether or not this can be achieved. There are different types of hair. Some people have fine hair, some people have thick, coarse hair. Some people have afro hair, which is of course even more thicker and very, very curly. There are different types of hair out there, and your surgeon should be experienced enough to look at the type of hair that you've got, have a look at your donor area, and give you a reasonable expectation of what the result is going to be. What I've seen is a lot of pressure sometimes from patients bringing me pictures of celebrities or other people and so on and saying, I want that. And I'll look at it, and to be honest, most of the time it can be achieved, but sometimes it can't be achieved, either because the patient has too much hair loss, therefore you can't achieve that level of regrowth, or the celebrity they've given me has a completely different type of hair. This needs to be explained, and sometimes this leads to some conflict going on between what are the expectations and what's the likely result. This is why it's always important to have a good chat with your surgeon beforehand, and you should always be having a chat with the surgeon before you actually go ahead for a transplant, so they can explain to you what is actually possible. What I say to my patients is, you're here to tell me what you want, and I'm here to tell you what can be done. And most of the time that is on the same page, but every now and then we might be a little bit apart. Number 6, choosing a surgeon who's not a specialist. Now, it doesn't mean that a surgeon who's also doing plastic surgery or cosmetics is not going to be good at doing it. Certainly they'll be very good at doing it, but when you choose a surgeon, you want to know that they have good experience in performing hair transplant surgeries. And a lot of doctors choose to specialize in this one field, because really when it comes to hair transplants, yes, there's a mechanical, there's a surgical, there's a sort of a by the book way of doing it, but a lot of the final result also rests on that surgeon's artistic eye, right? The aesthetic element of it. What's going to look good for your facial shape, for your skull shape, for your type of hair. A lot of that is learned through experience, right? The surgeon makes recommendations and opinions based on cases that they've done before. And so that eyeball, that sort of artistic eye needs to be developed by a good surgeon. And you only really get that by doing a lot of surgeries. And lastly, number 7 is being distracted by new tech, by the hype around new tech and marketing claims. One of the issues I've got with this industry, because it can be quite unregulated sometimes, these outlandish marketing claims that I'm hearing from some people. I'm hearing nowadays that you can regrow hair in the donor area. That is false, right? Yes, certainly you can make the donor hair thicker and it can cover the area and it can look pretty normal. But remember, it is a hair follicle transplant. We are extracting the entire follicle from that area and putting it there. So the hair in the area does not regrow. But you don't take everything. You take a percentage, right? You take maybe 10 to 15% of what's available. There might be 30 to 40,000 grafts available. You would take 3 to 4,000. If you do it that way, you only lose about 10% of what's there. It's not really visible after. But if you only have 10,000, 15,000 grafts available because your donor area is already a bit compromised, and then you try and take 3 or 4,000, it's going to be very visible after. So don't fall into the trap of people claiming that they can regrow hair in the donor area. That is false. That's not possible, because we are extracting that entire architecture, that entire follicle from the area. The hair does not regrow. There's also other marketing claims that sometimes have a bone to pick. There's new techniques always coming out. One of the newest is something called DHI, which is direct hair implantation. I see a lot on the marketing material saying that there's less scarring in the donor area. Well, if you've seen some of my previous videos, I go through what is DHI, what is FUE, what is FUT, right? Long story short, FUE and DHI have the exact same method of extraction from the donor area. And so the question to you is, if it's the exact same method of extraction, then how is there any difference between the risk of scarring? The answer is no, there's no difference in the risk of scarring. The risk is still the same with both different methods. But you will see on marketing a lot, especially from some people that are trying to generate a lot more new business, about DHI being less scarring overall, especially in the donor area. That's simply a false claim. Rather, do your research, watch videos or read resources from people that are reputable, people that you trust, and ultimately make the right decision for yourself. So that's 7 common regrets. There's a few more out there, but I think these are probably the most common regrets that I hear from people afterwards, or people that have been to different hair transplant clinics. Maybe they've gone abroad, Turkey, so on, and they've come to me afterwards because they're not quite happy with their final result and they want to get things touched up. These are the most common regrets I come across. Let's sum up everything that I said, how to avoid these regrets. Careful planning, choosing the right clinic, choosing the right surgeon, following all of the post-op instructions properly, and having realistic expectations with what can be done in your case. If you follow these, you'll have much less chance of having any regrets afterwards, and hopefully you get to enjoy your new hairline for the rest of your life. If you guys have any experiences, if you maybe had one before or you regret what's been going on, please share your ideas, share your thoughts or your experiences in the comments below. Don't forget to subscribe to us because we have a lot more videos going through everything hair transplant related and some medical things as well. And of course, if you're looking to get one done, don't hesitate to contact my clinic, Royal Wolf Clinic, where we can get you sorted.